Pay attention. How many times can you tell your child to pay attention before they finally get the message? For some parents and teachers, it feels endless. But paying attention is not as simple as it seems. And today, we are going to explore ADHD and attention, what's happening in the brain, what you can do to support your child with attention challenges, and how attention can be trained. This is LD Expert Live. Students with attention challenges may get up every morning determined to pay attention and get their work done and submit it on time, only to get to the end of the day and find first period's homework still sitting there, not completed. In spite of best intentions, intelligence, motivation, and effort, students with learning and attention challenges often disappoint themselves and their parents and their teachers. The good news is that both learning and attention challenges can be changed. Welcome to LD Expert Live, your place for answers and solutions for learning differences, dyslexia, and attention challenges. I'm Jill Stowell, founder of Stowell Learning Centers and author of At Wit's End, A Parent's Guide to Ending the Struggle, Tears, and Turmoil of Learning Disabilities. To get a free copy, go to parentsatwitsend.com. I want to give a shout out to all our faithful viewers who join us every Tuesday at 10 a.m. And if you're new to the broadcast and you find it helpful, be sure to subscribe. Let's say hello to Maddie. Maddie is part of our amazing clinical staff and a team leader in our Irvine, California Center. Good morning, Maddie.
Good morning, everyone. I'm super excited to hear what Dr. Licata has to say today. I know ADHD is such a hot topic, so I'm excited to see everyone's comments. Definitely let us know where you're checking in from. I will be checking back to see your questions, so definitely leave them below.
Great. Thanks, Maddie. If you're just joining us, this is LD Expert Live. I'm your host, Jill Stowell. Today, we're talking about attention, understanding it, training it, and how to support your child with ADHD or attention challenges. Our guest today is Dr. Giancarlo Licata. You may remember him from our May 19th broadcast on sleep. He is back by popular demand. Dr. Licata is the founder of Vital Brain Training and Vital Head and Spinal Care, which is a brain-based health practice in Pasadena, California, focusing on brain-based tools to improve pain and performance. Vital was established in 2008 and has helped over 2,000 clients, including professional athletes from the NFL, Major League Baseball, and the NCAA. Dr. Licata and Vital have been featured on PBS, ABC, and WebMD. Welcome back, Dr. Licata.
Hello, good morning. Thank you. It's good to be here.
It is nice to have you. You know, when students struggle in school, the first thing that teachers see in the classroom is lack of attention. And now with distance learning, parents are getting a firsthand look at just how much their kids are struggling with attention. The thing that concerns me is that most people seem to think that attention symptoms automatically mean that you have ADHD and you need medication. You and I both have a little bit different view of attention, and I would love for you to just talk about what attention is and how we measure it.
Yeah, great. Well, I'm a parent of three, and I understand. I find myself telling my kids all the time, pay attention. I'm gonna start this 5-hour monologue on the value of, hard work, and in 2 seconds they're off, and they don't pay attention to me. So attention is a very powerful word, and we tend to throw it around, and it doesn't mean much because we can't land on a clear boundary as to what it means and what it doesn't mean, right? So. From a neurocognitive standpoint, attention is the ability to divert all of our resources of our brain to something, and it's either external, you, this show, or it's internal. It's my thoughts and my racing mind, or oh, what am I gonna make for breakfast this morning before my kids get up, right? Those are the things that demand my attention. And so in an external world, it has to do with my ability to we break that down into two things. My ability to hold my awareness onto one thing and stop my tendency to jump to something else, right? So there's actually two components to my external attention. Hold my awareness on one thing and turn off my tendency to jump to something else, right? And so now the problem is, we're usually defining attention or inattention by just our behavior, right? If my child can't pay attention at school, then I take them to the pediatrician, or I take them to a learning specialist or an educational therapist, and they seem to ask me a bunch of questions. And they say, well, does your child jitter when he's in class? Does he interrupt the teacher? Does he do these things? And if enough of the boxes get checked, well, now all of a sudden we slap a label on this child and we say, well, your new identity is that you have ADHD, right? And so that becomes a whole nother road that now parents find themselves on. And I think that what you're saying is that there's other roads, there's other ways to look at it. So hope that should be enough to get this conversation going.
Yeah. It's true when kids are identified as having ADHD, a lot of times then that just sort of becomes their identity in their whole family and in their classroom. Some students treat it like a crutch or an excuse, kind of, and sometimes parents and teachers then see that as a limiting factor or reason to have lower expectations for that student.
Yeah. I think as a parent, the only time I really care about my child's attention is when it impacts my child's behavior or performance, really. And so if my child is getting bad grades, I start worrying about his attention, right? Or if my child can't obey me when I'm at the grocery store and they're all over the place, well, now I get concerned about my child's attention. And so I try to get practical about this, and attention is something that why is my child not able to sit in class when the other kids are able to sit in class? Or why is my child not able to, sit quietly and, read a book when the other kids are able to do so? And so, what that is it's a present level of function. Mm-hmm. Really, it's a current level of function. My child has these things that are turned on too high or too low, and the problem is the second we take them to get tested, and the second they give them this label, now what happens is this label gives me and my child, what you're saying, this permanent identity, right? So we're going from current level of function to now a permanent identity. Current level of function is, when it's hard for me to hold attention or resist impulses. The identity is, I have ADHD, right? I have attention deficit hyperactivity disorder, right? And so that's like, I have cancer, or I have Alzheimer's, right? It's a label that we now carry, and it shapes our whole identity. So to be able to extricate those two things is already the beginning of something that is very powerful, because you now have more choices as a parent, right? So yes, I think that's a really key principle. It's a very key thing as a parent that we want to be able to understand, because if it's an identity and it's now a disease, the same way that it falls in the same category as cancers or Alzheimer's, ADHD, Parkinson's, they all seem like they're in the same group. Well, now we tend to think, well, now I need a medication to match this disease. I need a medication to match this condition, right? It's a passive identity. And so now I'm not empowered. I need to take a medication to kind of help my child stay focused. And unfortunately, most of the time medication may not work, and that's another conversation. But if it does, it's essentially because what we're taking is a form of amphetamine. And an amphetamine is like speed. It's like these, and Ritalin is one version of it, and there are others. And it's designed to speed up the brain waves in a particular area of the brain that tend to go a little bit too low. And when they're a little bit too slow or low, we become a little bit lost in our thoughts. Or it's harder for us to kind of engage and hold our attention in a particular place, or resist our impulses to go somewhere else. And that speed, or that amphetamine, or that Ritalin, or whatever that is, now all of a sudden that helps speed up those brain waves in that one little area. And that allows us to kind of just be calmer, right? So for some children, it's magic. It's magic. But now, that child now becomes dependent on that medication to feel normal again. And again, your amazing work, what we're trying to do too, is to say, look, let's have a different conversation. Let's take this from an identity to a present level of function. And if it's a present level of function, let's look at seeing if we can maybe identify what those areas are and help them in a way that's more natural or less dependent on medication. So we're not saying it's one or the other. We just think that maybe not everything should fall within the category of, this is my identity, this is my condition, and I'm now a passive recipient of some medication that you're going to give me. So
right, and I'm stuck like this. I can't do anything about it.
Right.
So,
right.
Yeah.
Right.
You know, a couple of times you've kind of alluded to something that that I find really interesting. So many kids who have attention challenges will be described as impulsive. And I would love for you to talk a little bit about, from a brain perspective, kind of what that means if we've got this impulsivity going on and low attention. You know, I find that a really interesting thing, and I think it adds some clarity.
Yeah. And I'm gonna, for some of our parents who may have already have children who are diagnosed with attention deficit hyperactivity disorder, I'm gonna classify it in the way that the DSM-5, the common way to diagnose ADHD is set up, and then I'll talk about looking at it from a performance way. If our child is diagnosed with ADHD, usually based on a checklist behavior, right? There's no actual test, functionally to see what's going on. Did we check enough boxes off the list? Then you've got it, right? That's first of all. But it seems like they subcategorize that into, do I have ADHD inattentive, meaning it's harder for me to hold my attention, or do I have ADHD impulsive hyperactive, right? I'm impulsive hyperactive. I'm just going all over the place. And we all have kids or know kids that are like that. They're just everywhere. Johnny, sit down. Johnny, sit down. Johnny, stop kicking your sister. Johnny, stop, hanging on the chandelier. Johnny, stop, right? And so that's the impulsive hyperactive, right? And then some people, they diagnose them as having a little bit of both. I'm inattentive and I'm impulsive hyperactive. Right now, okay, that's helpful, and they have medications to try to match that. Now, what we're looking at though is the impulsivity is oftentimes going to be driven by another part of the brain, and the impulsivity is a part that's it's go. It's when I'm interrupting you in the middle of a conversation. It's when I'm in the middle of something and I just need to get up and go do something else. And so it's a jumpiness. It's an inability to just be here, right? And so now in the brain, there's certain regions of the brain around the midline as well as in the front midline that tends to make us feel a little bit more jumpy, just going after it. Now, and so that's a different region of the brain than the part of our brain that I can be present, but maybe I'm not paying attention to you. I can be present, but I'm not following what you're telling me, right? This is the child who's they're sitting in their chair. They're cooperating, but you're like, okay, are you following me? Point A, point B, point C, point D, and by point B, they're just somewhere else. Sometimes they're kind of in their brain and they're lost in thoughts, or they're daydreaming. Right? That's another part of attention that's not right. It's not performed well. It's not tuned in, but it's different than this impulsivity, right? And sometimes our kids have a little bit of both, right? So so I don't know if that answers the question, but that impulsivity is something that is different than just the inattention. And sometimes our kids have a little bit of both of them intertwined.
Right. And I know that you and I have collaborated a little bit, and it's been really interesting to me to get to see the brain mapping that you do with students. And you know, we have talked about the fact that sometimes with that impulsivity, they are trying so hard to pay attention, but they can't. And then if the attention part of the brain is low and impulse control is high, then you've got this kid that's working so hard and so exhausted by this, even though that may not be what it looks like on the outside, but that, you know, that the brain is actually working too hard to pay attention.
Oh yeah, yes, it's something that we can see, and we'll probably, you know, we're already talking about brain maps, and I'll probably start defining that and set the stage for brain maps. But yes, there are a lot of kids who we will map, and we'll do also additional tests like an IVA 2 attention and impulse control test, and that's something that you do as well, I know. And we can see something called stamina. This is that kind of grit part of the brain. This is the kind of the ability of us to just push through, to just, it's not easy, but I'm going to keep going, right? And that's some of the exhaustion that we'll see in a child, where they're really trying hard. I mean, they're really trying to pay attention. They just can't. And so I say it's like you get this amazingly wonderful Rottweiler puppy, and it's just so strong and it's so powerful and it's pulling you all over the place, right? Or you know, so it's just I have a metaphor of just a very strong, poorly trained puppy that is dragging the owner everywhere, all across the neighborhood. And that's what sometimes our brains or our children's brains feel like. And now the problem is that that child isn't they're not being disobedient, right? They're not trying to get in trouble. They're not, there's not a, you know, they're not trying to do the opposite of what you want them to do. Their little puppy, right, is out of control. It's not able to be trained. And so we can try to drug the puppy. Okay, that's one way to do it. But what if we can identify what the puppy's doing, identify where it is, and begin to train it in a way that's a little bit more humane, a little bit more compassionate, a little bit more, there's a little bit more wisdom to it. That's what we're trying to do, and that's what you do so well as well.
And we are going to talk about that in more depth a little bit later, because I just think it's so important for people to understand that there are many ways to look at these things. So I know when we have talked before, you've talked about how there are some things that can disrupt attention or even mimic attention challenges, things that are going on that. So now it looks like the child has ADHD. Right.
And so, okay, so we set the stage for this conversation around the attention is not necessarily a disease. It's more of things that are functioning too high or too low. And we identified already a few different things, like my ability to hold attention, my ability to resist the puppy, the impulses. Now, the challenge is when I just go back on that list and I start checking off behaviors, the problem is there are other things that will mimic those two regions of the brain that will cause the person to check off something off the list. Right. And so let's say so what are the imposters that get in the way of our ability to pay attention? Right. Well, you know, internal anxiety and rumination will look like inattention. Right. And I'm sure we've done it before. Right. Our spouse is talking to us and they're telling us about their day. And all of a sudden we're here just really worrying, just really racking our brains on something. And sometimes it's on loop. It's not necessarily like we're making any progress on it. We just somehow feel the need to kind of keep going it over and over and over again. Well, that's the anterior cingulate of the brain. It's what the brain does. And if that's kind of on overdrive, on overactive, it will look like I'm not paying attention to my spouse. Like I don't care. And of course, the spouse is telling themselves the story of see, they never care about what I have to say. They don't care about my day. It's whatever their life is more important than mine. But in my brain, what's mimicking inattention is this internal anxiety kind of hamster wheel, right? And so now, when we brain map, we can see regions of the brain that are doing that. They're overactive. It's front midline. We can see it on a map, and it's very high in what we call high betas. And I'm now throwing terms that I'll define in a second. But the whole point is, our child is really dealing with a form of, again, it's not a good word, but kind of an anxiety, right? It's an over stress. It's an overstimulation. It's an internal kind of suffering, really. And now we're yelling at them because they're not paying attention to the teacher. And so the child is stressed. The child feels anxious. The child's ruminating. And then the teacher's saying, well, what's the square root of 64? And Bobby's not paying attention, right? And so it's like, Bobby's never paying attention. It's always the same thing. I call on him and he's just never responding. He's always like, what, where, why, right? And so that's a mimicker. It mimics the inability to pay attention, but really it's a rumination. It's an anxiety. It's stress. Okay. So that's one. And that's, and I think we work with Stowell Learning Centers. We have clients in common, and that was a common thing, that one client who had a form of inattention, that was something we saw on the brain map, and that was something we were able to help train a little bit. And we saw how all of a sudden Bobby was able to pay more attention to what's interacting right in front of them, because they're not stuck in their little world, Yeah.
Yeah. And, I think we kind of forget as we go through our day-to-day existence that there's a lot more to what we see. I mean, what's going on in the brain is pretty profound, actually. But a lot of times kids who have attention challenges, they move, or they tap, or they click their pen, and it drives everybody crazy.
Yeah. Yes.
But that could actually be something that they're doing to try to calm themselves.
Yeah. It's interesting, and there are two kind of versions of that we see, or that we know about. I'm sure there are more. And so there's moving and tapping. Sometimes we do to calm, right? When my wife knows that I'm overly stimulated about something, I'm stressed out about something, I'm really trying to, it's getting me all worked up. She knows, because my leg's just going, right? My leg is just moving all over the place. And so what I'm trying to do is down-regulate my nervous system through movement, right? Movement ends up being a little bit of a down. Well, it can down or up-regulate our body. I'm going to give two examples. And so one of them we know about is when we're trying to down-regulate. And so there are certain kids that, again, they're dealing with stress, and we're going to call this stress, but just stressful homes, stressful, parents are fighting. Maybe parents are going through a divorce. Maybe, their older brother or sister is dealing with some kind of drugs or issues of teenage years. Corona, and the kids' whole worlds seems like everything is falling apart. And so what happens is they feel very, very over aroused, and aroused not in the fancy word or fancy way of the word, but aroused like my nervous system is just tuned up too high. And so movement ends up being a way to kind of lower that arousal. It's trying to regulate a little bit, right? Yeah. So now the child, really the solution for that child is to help that child feel reconnected, to feel more regulated, right? And so the solution is not going to be to drug the child. And in fact, that child we give certain medications to, and they're going to feel even more. And they may feel like they can focus, but they'll have such an increased level of anxiety inside of them that, yeah, they're getting better grades, but really probably their quality of life may not be much better. Mm-hmm. Now, if that's movement to downregulate, there's also movement to upregulate. And so think about if you're driving long hours at night and you've got another 2 hours to go and you're falling asleep at the wheel, right? What will we tend to do? We'll tend to open the windows. We'll tend to bring the radio really loud. We'll tend to start moving around, right? Because what we're actually trying to do is we're trying to upregulate our body. We're trying to get our nervous system to be more aroused because it's not aroused enough. It's not tuned up high enough. And so sometimes we'll see kids who are just kind of falling asleep or they're just kind of not there. And all of a sudden you just see them, okay, all right, and they're just moving all over the place. Well, they're trying to upregulate. Now, there's the whole point. There are other ways to do it. There are ways to do it. If you can identify what it is, there's other tools. There's other tools that you can do to do that. So,
Right.
Yeah.
Right. Yeah. Another impersonator of attention challenges is what we see all the time with our struggling learners is weak underlying skills, weak auditory processing or visual disorientation on the page, or difficult, slow processing speed. I mean, there are just so many underlying pieces to learning, foundational skills that help us to be efficient learners. And most people think about learning as reading and academics and math. And that is the tip of the iceberg, but underneath it, there are all kinds of skills that support that. And if any of those underlying skills are weak, then it can cause a student, it will impact a student's attention. And so, the vast majority of the students who come to us at the Learning Center initially, look like they have attention challenges. But once those underlying skills are developed, the attention symptoms often disappear right along with, the increased success at school. However, there are a lot of components to attention, and sometimes attention really is the root cause of the student's struggles in school. And you've kind of alluded to this, that attention can be trained. And we both know that, and we've worked together with some students on it. And so I definitely want to talk about it. Before we do that, though, what are some things that parents can do to help their struggling students with attention? Just some day-to-day things.
Some day-to-day things. Yes. So what's interesting about this? So let's use the arousal challenge. One of the things we saw, and everyone can tune back to our sleep episode that happened back in May. What's fascinating about the brain is that if we don't get good sleep, we will start to have, our brain will start to be under-aroused and will function more on a theta, and so we'll go into that, a theta brainwave state, which will cause us to be, will tend to be more inattentive. I mean, it's a very, on so many levels, poor sleep will create more inattention as well as more mimickers of inattention. Okay, so sleep. That's a big thing. And so what can a parent do? A parent can try to have good, healthy sleep habits for their child. A parent can set some compassionate yet clear boundaries for their child's sleep schedule, right? And so, so sleep is one, when we can go deeper into sleep. Another one, though, is our food. So I'll go into the story about food, but if our child's brain is going through the sugar roller coaster, we eat something that turns into sugar or is sugar, we get a huge boost of too much blood sugar in our brain becomes over-aroused, and then our body tries to say, no, that's way too much, and it releases all this insulin, and then it takes all that sugar out of the blood, stores it in our fat cells, and then we get this crash, right? And so what happens when Bobby has, Fruity Pebbles, 2 bowls with some orange juice, that's the equivalent of maybe about, 80 to 90 grams of sugar, and all of a sudden, by the time Bobby gets on the bus or is in the car and ready to kind of drive into school, Bobby's going to be all over the place. Bobby wants to jump out the window and run alongside the car because Bobby has so much energy. Now, that's not a brain that can actually focus. That's over-aroused, right? Now, the problem is by the time Bobby finally says hi to his friends, puts his backpack down in the classroom and sits down in his desk, now that's right about the timing that the insulin did its job and all the sugar is running out of the blood, and the brain now just has nothing left, right? And so now that's not an intention problem, that's a diet problem, meaning that's my food is sabotaging me. And what a parent can do is pick our battles, but have a compassionate food boundaries and understand what food does to us, both in the short term and the long term. And sugar is going to be a saboteur of good attention, right?
Right.
So sleep and food I think are going to be big ones. And then the third one is going to be that emotional connection when we lack it, that attachment that so many great speakers talk about. That attachment to the parent, that sense of safety and calmness, and maybe the world is falling apart, but at least my little world at home is okay. That attachment will also become powerful, and many of the behaviors that we tend to associate with inattention start to settle down, right? And so what we want to do is, at the very least, we can do that. Like, we can start there, right? And so those are important tips.
Great. And, just going back to food, just a little bit, because our kids are heading back to school, whether it's at home or at school. Giving your child protein for breakfast will help the brain to have the energy that it needs, to learn. So,
yeah. Yes, no, you're absolutely right. Our food, so the brain really needs a consistent stream of energy, just consistent. That's what it wants. Now, we can still have little highs and lows, but we need a good consistent amount. So I say it's like a good drummer on a band, right? Like, you just need somebody holding a certain beat, just hold the rhythm, right? And so good proteins, and believe it or not, this is, it used to be controversial. It's not anymore. The science is very clear on it. Good, healthy fats become really great, consistent energy sources for the brain and for the body, really. And so if we have something like the good traditional farmer's breakfast, believe it or not, maybe some bacon, some avocado, have some veggies in there, but an egg or two. Believe it or not, at the end of the day, your child will be better off during that day and for overall health if they had that versus, again, the sugary cereal drinks with sugary OJ or whatever they're having, because they're getting that consistency. They're getting that. And parents oftentimes think, well, oh my gosh, no, that was supposed to be bad. Remember, the Heart Association said that fats are bad. I mean, from 2008, there's been an overwhelming amount of evidence showing that no, fats are not bad. Fats are necessary for the body. Too much inflammation can create good fats to become bad, but really what creates the inflammation is sugar. It's the sugar is the main inflammator of the brain, if that was a word. And so, we're not doing our kids harm if we give them some good, consistent proteins and fats. But again, we don't want to take the fats out. I think it's almost impossible to have that consistency without healthy, good oils and fats. Mm-hmm. So.
Yeah, it can be very confusing. So many conflicting messages, but I think we all do basically know that sleep and diet, and of course movement and water, are critical to brain health, thinking, memory, and attention. But it's still hard to make changes. So just putting a little understanding under it, I think, really, really helps.
Yeah.
Let's jump into the chat for a minute and say hi to our subscribers and viewers and see what they have to say. Hey, Maddie.
Hello. Hi. Oh my goodness, this stuff is so interesting. I'm like resonating with so much of the stuff you said. I have like students in mind for everything, but the comment you made about the puppy analogy and not being disobedient, it's just really like not having that regulation, that skill. It's so important, I think, for people to understand. And that's definitely something I've picked up on since working at Stowell Center. So yeah, I just want to reemphasize that. I think it's so important. We do have a few people checking in and saying hi. We have Karen from Sacramento. Hi, Karen. Thanks for joining us. We have a question from Amanda. Really good question. She says, how can I discern why my child cannot make eye contact when I'm trying to get him to listen? So he was diagnosed. He has a few things going on, diagnosed with mild autism, severe ADHD combined type, and auditory processing disorder. So I think maybe wondering, like, is it the social component? Is it the attention component that's making it difficult to make eye contact?
Jill, do you want me to jump in first, or would you like to jump in?
Go ahead.
Okay. Well, and again, my forte is not in autism or Asperger's or any of ASD, but the eye contact can tend to be a different part of the brain, and it can tend to be more a function of some of the Asperger's mild autism than the inattention, though sometimes there's a little bit of both, right? And so, but yeah, so that may be it. Now that would be a whole nother rabbit trail that we can go down, but that would be the short answer, is it could be a little bit of both, but it definitely will be more likely on the mild autism side. But even the mild autism, if we look at the brain like a mansion with many rooms and hallways, then we can maybe not necessarily throw away, but we can have this kind of binocular vision, be able to see two things at the same time, or be able to flicker between the two. Not just, I have autism, I have Asperger's, I have ADHD, but rather, which rooms are overfiring or underfiring?
Right.
Which rooms are connecting more or not connected enough? And so the problem, and I say that because oftentimes, if there's a certain room that is overfiring, well, it may make me a little bit quirky. It may make me a little bit, less socially active. But if it overfires up to a certain level, beyond a certain level, now all of a sudden that can be now categorized as some type of Asperger's, right? Mm-hmm. And so an Asperger's may involve 5 or 6 or 20 rooms. And so, but again, the label disempowers me. I hate to say it, but I'm, as a parent, fine, it may give me a little bit of comfort to know that at least there's a name for this thing, but it doesn't give me any empowerment to do anything about it. But if I can understand that my child in my brain is not just one glob of jelly, it's actually this mansion with many rooms, specialized rooms and hallways that connect them. And in order for me to do everything I need to do, requires each one of these rooms to be able to be not too high, not too little. Ideally, they're little Goldilocks. And so what if I can understand my child's brain from that perspective, now I can start looking for tools that are going to be able to maybe make this area a little bit higher, this area a little bit lower, help regulate these things. So I'm now more empowered. I can now start looking for real practical tools. And that's what Stowell Learning Center is about, is breaking that down into those core functions. And let's find tools to help those different things. So for me as a parent, I want to be empowered. I don't want to just be lulled back to think, well, at least that's what he's got, so someone else will take care of him. I'm the type of parent that I want to now go find tools for my child. And that second model is going to help me do that better, I believe. So
right. And when you talk about labels, I think the value of a label for me as a practitioner is that it helps me to understand a child's thinking style a little bit better, so that I can identify those rooms that are over or under firing. But I agree. I mean, you are not your ADHD, or you are not your autism, or whatever it is. Now, in relation to this question, it's interesting because there are different reasons why someone might have difficulty with eye contact. It could be, and this does happen sometimes with our kids that are on the autism spectrum. Sometimes their eyes are taking in too much light, and so it's a little bit painful for them to look at someone else's eyes. So that could be part of it. And again, that is something that can be trained. The eyes can be trained to, and the brain can be trained to take in light properly. And then the other thing is with auditory processing, sometimes students have to work so hard to get the information auditorily that they kind of have to shut off the other sense, and they can't be looking and listening at the same time. So that's a really good question, and there's not a simple answer, but it is something that we certainly have explored with students. And then when we can identify where it's coming from, then we can really work to make that aspect work more effectively.
Yeah.
Awesome. I know there's so many factors, so it's really good to hear that all broken down. We've got another question. We have a couple questions kind of about steps to take when seeking a doctor, but I'll start here. So Susan is asking, what's the best way and what kind of doctor do I see to test for ADD or ADHD? And once the testing is done, what are some of the treatments besides drugs? Any thoughts on that?
So the treatment part we are going to be talking about. We definitely want to devote some time to that, but go ahead, Dr. Licata.
Well, again, so what we need to know is that the majority of, again, if we're looking for the diagnosis of ADD or ADHD, and there's an incentive structure behind getting our kids diagnosed. We'll get, many times governments will pay for extra classes, or there's certain benefits to getting the diagnosis, and that's a little bit of another conversation. But in short, it's usually pediatricians that end up doing the diagnosis. It's usually pediatricians. It seems like the majority of our colleagues it's the pediatricians that do it, and then they're the ones that diagnose it. Now, psychiatrists also tend to diagnose and prescribe. And so those tend to be the two avenues through which people end up getting that diagnosis. Now, what we have to understand, though, is that we can't hold our doctors accountable, or we can't hold them guilty for then prescribing a medication when, in essence, that's what their license allows them to do, is prescribe a medication. And so and I think that that's what they're great at. And so I'm trying to kind of tiptoe around this, because in essence, where we're going to go get the diagnosis is usually the next step is going to be to get a medication. And if we are okay with that, and we understand that that's the lens that the doctor is going to be wearing when you go get tested, then then we can understand that, okay, well, that's my doctor's lens. I'm going to now understand that I'm not going to hold them. I'm not going to be surprised when they don't recommend some other things. Okay.
Right.
And so, now, I'm not going to say to do one thing or the other, but I just want you to be empowered with that. Now, there are others that can do things that will help look at the breakdown of the brain and see, well, what's over-functioning and under-functioning. And again, Stowell Learning Centers is a wonderful place to do that. We do brain mapping. We can also see what the brain's doing. There's a whole group of specialists called neuropsychologists. They can also do like 1 to 2 day full testing. I mean, they test everything under the sun to see how is your child functioning, and what are the different rooms doing in the hallways, and how is that playing out in this in my child's personality and their emotions and their ability to do things at school. So I guess this is kind of a roundabout way to say there's the conventional, and then there are these others. And as long as we have good expectations about what they're going to give us, then we won't be disappointed. Okay, so I don't know. That's gonna be my best answer for that one.
Yeah. And so, as a parent, if you really need to have that diagnosis in order for your child to get an IEP at school, or get a 504 plan or some kind of support, then you're probably going to go to your pediatrician and to get that. And but there are people that more do a more natural approach to treatment with supplements and diet. Sometimes that is chiropractors, sometimes that's a naturopath. At Stowell Learning Centers, we really look to try to evaluate, what are the underlying skills that are not supporting the student well enough and therefore stressing the attention system, because then we can develop those underlying skills and the attention symptoms usually go away. Or if attention is the key issue, then what we know from our experience is it usually is going to be a combination of training, which we do, and diet, and some kind of biological aspect, usually diet and maybe some supplements that are going to be a good combination. Dr. Licata, and so then there is, the kind of work that Dr. Licata does, which is really, really amazing, because they are looking at what parts of the brain are overfiring or underfiring, and actually have a pretty, based on our students' input, a pretty fun way to treat that and effective. So let's go ahead and talk about that, and then we'll come back and pick up the other questions.
Yeah. So we love science, and so we like Stowell Learning Centers want to create science-based tools to both measure and improve our function. I mean, that's really what this is about. And so what we do to measure the brain is we have, a child will come into the office and they will wear a cap. It's like a swimming cap with 19 different sensors, and we'll look at the brain waves. We'll literally see their brain waves, right? And this is called an EEG. And so right away, here's the difference between check a bunch of boxes off of a list. Oh, you've got ADHD or you don't. What about if we actually saw the actual brain waves of the child and measured those things, right? And so what we want to do is measure what the brain is doing, measure the different regions, and then we compare that child's brain to other boys or girls that child's age. And we don't want them to be just like everyone else, but we want to be able to see, well, does this child have access to a lot of the same things that other kids do? And so we can then begin to create a little bit of a fingerprint. We can create a little bit of a phenotype on, when we see brain waves that are too high or low in this one room, it tends to look like a certain flavor of inattention. It tends to do that. And if the child is coming in with inattention, well, wait a second, that fits, right? And so that's a way for us to measure. And that's what we call that brain mapping, measuring the brain waves of the brain. And then we test, then we train by literally putting a little stethoscope. And I say it's not really stethoscope, but it's just, we're not doing anything to the brain. We're just sensing the brain on that room. And then the child essentially plays video games with their mind. If they're doing it at home, it's about 15 minutes a day. If it's in the office, they're doing it for about 45 minutes, about 2 or 3 times a week. And so what we do is we get to train that region that was too high. We get to train it to slowly begin to lower itself so that it can access lower, slower brain waves. That's it. And we're not making it do one thing or the other. We just help it get unstuck. And then if it needs to go high, it can, but it doesn't have to stay there. It can go back down. And so in about 12 to 16 weeks, we see about a 50% improvement in the functions that are like attention or impulse control or any of those others, rather than have a child dependent on certain things for the rest of their life. So that's, in essence, that's what we do.
And I like talking about it getting unstuck, because it's so, we get into patterns and we sometimes have to have some help to break that pattern so that we can create a more effective one. And I will just tell you a little bit about, we recently collaborated with a student to do this neurofeedback brain training. And he was one of those kids whose brain was working so hard to pay attention, is what the brain map showed. But it really cost him in anxiety, which came across as withdrawal and lack of motivation. And then that was all compounded with remote schooling.
Oh, yeah.
But after completing the neurofeedback, we really saw very encouraging improvement in engagement and mood and focus. And then at the same time at the Learning Center, we were working with this student to develop the underlying skills that he needed to listen and read and think faster. And, you know, I really am excited for him to start school this year, because even though it's remote, I think it's going to go great for him. And, you know, that's awesome. That's why we do this work.
Yeah.
So,
yes. And what it is it's really about, we can see and measure potential. That's really what we're doing. Potential is no longer this kind of pie in the sky thing. Oh, you can be anything you want to be. You're 5'2" and you can be a professional NBA player. Maybe, but you may not have as much potential as someone other. But we can see potential, and we can see that you have everything you need. It's just there's certain patterns that are stuck, and those patterns, we can help them get unstuck. You can access things that you couldn't, that you feel more, the child feels more like you, like themselves. They feel like the fuller version of themselves. And to be able to do that in a way that's science-based, and be able to a way that's more rigorous than what is done conventionally, right? Mm-hmm. Before and after, measuring so many different types of, auditory processing, visual processing, attention, and measuring them over time, doing neurocognitive tests. I mean, it's more rigorous than checking out a bunch of boxes and then saying, well, good luck. Let's see how this goes. Right. That's, it's profound. And what Stowell Learning Centers allows kids to do, it's what we like to do too, is we love to help measure and then help your child access their potential, right, in a less fluffy way. Right. So yes, it's huge. It's huge.
I love that. Accessing your potential. Yeah. I love that. We do have quite a few questions, kind of going along with the skill-based stuff. We have a few questions along those lines. So Amy is wondering, what is your strategy for improving working memory for a child where their verbal comprehension and perceptual reasoning are very superior, but working memory is just average? I don't know who wants to tackle that, but that's the question.
Verbal comprehension, and tell me again, verbal comprehension and?
So verbal comprehension and reasoning are great, but working memory is more of the struggle.
I feel like I don't exactly have enough information to have a really good picture of exactly what we would do. But what we do in our assessment is we are looking at all of those factors. So long-term memory, working memory, attention, auditory processing, visual processing, reasoning, certainly verbal comprehension, and the academic pieces as well. But what I would want to look at is there something going on in the auditory or visual processing that is causing them to maybe not get accurate information to think with. It could be a memory issue, that they're not taking in enough information at one time. And so we have a number of different ways that we attack that. But we do processing skills training, which is heavily based in developing working memory and processing speed, which, if you wanted to know what it looks like, it looks like all different kinds of games and drills, and all the activities they're very different, but they're based in being able to build your working memory and your processing speed along with other critical underlying skills.
Mhm.
And it's intensive, but it's pretty fun.
Yeah. Yeah, and I think what Jill's also alluding to is that there are multiple types of working memory, right? So, and sometimes there's working memory in what we think is working memory, which is more short-term memory, and oftentimes they're superimposed. So there's a little bit of tanglement. So it's rooms and hallways, but there's entanglement in some of them, and so. Again, sometimes it's a little bit more testing that I'm sure that the Stowell Learning Centers do and we do, because it depends on that child. So, for instance, there's what we call standard working memory, and there's verbal memory, and then there's visual spatial memory. And usually, whenever you have one, it's coming along with some other things. So, there again, however you got tested, I think it's phenomenal that you're already asking that quality of question, because you're starting to think using a different operating system. You're starting to think like, what are the right ingredients that I want to give my child so they can make all the dishes that they can make, rather than just, how come my kid can't make good spaghetti, right? Like, so what ingredients does my child have? And that's an important question. So, but working memory, it really depends on what type of working memory. Is it really that they don't have great working memory, or is it more of a short-term memory? Is it verbal, visual, spatial, or is it a combination? That's where it gets harder on online to answer that simple question. But yeah.
All right, perfect. I know it's definitely complex. When I first read the question, I was like, is she a parent of ours? Like, she knows so many terms.
That's
like,
a great question. It's a
Yeah.
great, that is the type of questions we want to start asking. Now, that's a lot for a lot of us parents. I mean, it's easy for us to talk about this because we spend all of our day, every day, talking about this. But a parent who has a different profession, this is a whole new language. It's a whole new vocabulary. And so, that's okay. You don't need to know all of it, but do you have somebody who is at least thinking that way, that you can trust, right? Stowell Learning Centers is one of them. Vital, Head and Spine is one of them. You may have others in your area, but, we have people that fly in to see us. There's people that work remotely with Stowell. You just know that's, at least if you're starting to feel like, wait a second, I got to start thinking about this. I want to find professionals that are thinking this way. That's the beginning. Yeah.
Definitely.
Awesome. Along the lines of other professionals, we have a couple recommendation questions. And if you don't know off the top of your head, you can always let us know later. We can post them in the notes. But Susan's wondering if there are any recommendations for neurophysiologists. I don't know where she lives, but
yeah. So in essence, I don't, Joe. I'll let you go. This is my thought. Do you mean a neuropsychologist? And if you mean a neuropsychologist, we recommend people here in Pasadena, but California, but there are many others. But remember, I tend not to give great straight answers. I tend to try to help you with the context. The context is, I need someone who can test using this new way of thinking, who tests for my child's ingredients. And then I also may need others that can actually do the treatment or therapy or training for those things. And sometimes one person is great for testing, but they have nothing to offer you as far as the actual training. Some places are both. Stowell Learning Centers is both. We're both. But also my practice, we tend to be great with 4 things: sleep, attention, concussions, and anxiety-like tendencies. That's it. So we don't try to do everything, and we're not good at everything. And so we're great at those things. And when someone comes to us with more complex issues, we usually then say, well, maybe you need a team around you. Maybe we'll take care of this one part. Now that we have the right testing, you need certain ingredients. We'll do these parts, and maybe let's recommend someone, 2 or 3 others to do the others. So that's where, again, the thinking about who's the tester, who's the trainer, and some can do both, but can they do both for everything that my child needs? That's what we want to start to. That's how we want to start to think in a more empowered way, I think. So.
Okay, perfect. And then she did respond, yes, neuropsychology. So
okay, great.
yeah.
Yes. So I don't. And they're, but yeah, Jill, maybe you do in general, but.
Like you, we connect with professionals in our area, and when we find like-minded professionals, we definitely refer to them. Out of the area, not so much. I'm so sorry to say, but
yeah.
But I think that's really helpful what you're saying about how to think about it. So.
Great. And we do have another therapy question. What kind of therapy do you recommend to help my 7-year-old with big emotions and executive function skills?
Jill, do you want to go? I can go after you.
Go ahead.
Okay. So I think this may be a slight segue into the brain training in general. Across the country, there are probably about 500 or so people who do something called neurofeedback. And the challenge is that probably 90% don't start with a map. And so ideally, we'd like to have a child get a map. They wear it, they could see the brain waves, we know exactly what's going on. Then out of that, so it's a smaller group of the neurofeedback world. And then of that group, there are different people that have different qualities. It's a little bit of a Wild West, but they have different qualifications to be able to help a child train up or down some of these rooms or hallways. And so you may want to look around your area and see if someone is doing that. Someone is able to get a brain map. Someone does brain mapping. Someone does neurofeedback. And there's different subcategories of neurofeedback. But our practice, we only take on 4 types of clients. We tend to be very, very good at those 4, and we always keep focusing on getting better. But it's a resource. It's a tool. And so, we'll have people that will fly down, get the brain map, and then they fly home. And then we give them everything they need, and they just wear a little band around their head with a little sensor they can put on with a little bit of gel, and their child can play video games for 15 minutes a day. And it can train up or down some of these things. But big emotions is oftentimes a dysregulation of feeling. And there could be multiple rooms that are involved with that. And so it's a little bit of a slippery answer, but with the right map, we can tell you a lot more, right? And so we're good at doing the testing and doing the training, but the big emotion part is sometimes a little bit outside of our wheelhouse. But there may be others in your area who's asking the question that may be just right for you. So you may want to look them up.
Awesome.
And I'll tell you, again, of course, we don't really have enough information to give you exact, information about your child. But thinking about a 7-year-old who, has kind of overwhelming emotions, and you're thinking executive function, well, I think, one of the things could be that child is operating in fight or flight. And when we are, and sometimes that goes back to retained primitive reflexes, which we're going to do a show on one of these days because it's a big subject.
Yeah.
But if your child is kind of just operating in fight or flight, they're not going to have good executive function because the rational brain isn't even available while they're, kind of in that hyper alert state. And it's going to be very easy for them to be oversensitive, to fly off the handle. And so, these are definitely things that we deal with our students. But let me just give you 2 things that you can just try to start doing. You can, a lot of things come to mind, but here's one thing. When your child is in a pretty, not in a hyper alert state, but just, kind of a nice time that you're together, Teach them how to do we call it 5-count breathing. Young kids, sometimes we do 3-count, but just breathe in for, let's say, 3 counts. Breathe in, out. So breathe in through the nose, out through the mouth. If they can go up to 4 or 5 counts, great. Don't hold the breath, just in, 5, out, 5. In through the nose, out through the mouth. Do that. Just practice that. Practice it at different times of day when your child is doing fine. And that becomes a tool that he can use before things that tend to upset him. If it's reading or schoolwork or having to do chores, or, you start with your 5-count breath, do 3 of them in a row, starts to settle the system down. Another thought is what's called cross crawls. You could Google this and you'll probably see it on YouTube, a demonstration of cross crawls. It's through Brain Gym. And have your child cross elbow to the opposite knee, back and forth like this. And you do it with them to keep them from going too fast. And they just breathe slowly, do it for about a minute, and it will start to settle him down. And so if you know the triggers for him, do those things first. Use them as a brain break in school. That is just settling the system a little bit, and then he's going to be able to think more rationally. So those are a couple of thoughts.
That's wonderful.
Maddie, let's go back to you so we can kind of wrap up.
Yeah. So this is, I know you talked a lot about professionals, so the answer might be the same. I'll take it down in a second. But Heather expresses that her son has actually Tourette Syndrome, and they're homeschooling. They've tried for 7 years to help him with his retention and attention skills. He struggles in math and in general, just retention. But he loves music. And so he tends to have better attention when it's something that he likes. So she's kind of just asking for maybe some other tips when they go to see the doctor. I don't know if it applies the same other stuff you said, but if there's anything additional for her situation, we'd love to hear it.
Yeah. I think the short answer for her may be to find a neurofeedback specialist who has experience working with Tourette's. Tourette's will be a constant interrupter to his brain, right? To his brain. It's 100 times a second. And oftentimes, it's when it's finally loud enough that it comes out, but the brain in small ways is just doing this overfiring. And so it's going to be near impossible to hold a certain train of thought or any constant attention because of that. And so it may not be a solution for Tourette's, but it may turn that down enough to the point where it's now, functional. And again, I think we don't work with it, but it's something that I do know there are specialists that work with in the neurofeedback world. Try it. Outside of that, I don't know.
All right.
Yeah.
Well, thank you for that. We do have a question. I'm not super familiar with this, but maybe you guys are. Can people be HSP type, good use using sensory and problem solving, 3D spatial use, etc., and be with ADHD that needs treating? Any thoughts on that one?
I don't know. I think what you're asking, I'll answer this. The brain reserves the right to have more than one room not working as great as we want, right? And all the combination of rooms and hallways that are not as great as we'd like become the source of every diagnosis we give, really. So you can have a lot of things not right, and that's where I think Jill has been alluding to often. If you have someone who's looking at the different ways and can start training them individually or collectively together, then the training becomes customized to the child. Because you could totally have that. You can have multiple things all at once. In fact, anybody who's worked with children know there's usually more than one thing always happening at once, right?
Right.
Again, I think Jill's been ahead of her time, breaking down not just what again, if it's a metaphor of food, gosh, my kid has spaghetti problems. They have spaghetti problems. Well, if Jill breaks it down and says, well, what are the ingredients that you're working with right here? Let's see if we can fix the ingredients. The plate of spaghetti may be better, right? Or, oh, my child has whatever, pork chop problems. Like let's bring it down to the core ingredients. And so yes, you could totally have multiple things. I'm sure they do. So then the question is no, and then find the right tools to fit that child's needs.
And, in our experience, the encouraging thing is that as you start to work in one or two of those areas, it's kind of like other areas begin to come in line as well. So that's an encouraging thing.
Oh, yeah.
We have amazing brains.
It's true. It's true. We do have a question about assessments. I don't know if she's talking about functional assessments like we do or more of a clinical type of assessment, but Ronke is wondering how much of these assessments can be done virtually?
Jill, I'll leave that to you.
We do, there are certainly some things that we do that the testing world hasn't found a way to do remotely yet, but we do remote screenings now and really have since March and have found it to be very, very effective. And I think that's partly because what we're doing is a functional assessment. We really want to see, how things are working in real life. So a lot can be done remotely. We have been really, really pleased with that.
Yes, I can definitely attest to that. We've started so many students, at least at the Irvine branch, with purely remote. Yeah, we did their full screening and they're like finishing up their stuff right now, which is really cool to see. We had a question about I think it's a particular assessment. I'm not familiar. What about the WISC-IV test? Are you familiar with that one?
The WISC, yeah. I do not give that test. That is given by a psychologist, school psychologist, or a clinical psychologist. And I don't know if that can be given remotely yet or not.
Okay, perfect. Sorry, that was out of order. I should have given some context. That she wasn't asking about remote, just any opinions on it, I guess, and it's effective, or I don't know, any opinions on the test in general.
Well, remember, if I can comment on it, there are, at least we're talking, so tests become functional assessments, and functional is, how are they able to access certain, again, rooms and hallways? There are many rooms and hallways, so there must be many functional tests. And there will be no one single test that measures every single room and hallway. The best attempt at it is a 1 to 2 day full battery where you're literally in the office for 1 to 2 days straight taking tests. And that is what a neuropsychological test is trying to do. Mm-hmm. And oftentimes the cost for that is, much more, sometimes 3, 4, 5 times the price of the training for the individual things that you want to do. Right. So there are many tests. There are many tests now. Again, for a parent who wants to navigate the world of tests, just understand, well, are they testing a certain levels of what we call intelligence? Are they looking at some of these core resources? I like Stowell's, philosophy, and if you read Jill Stowell's book, if you can understand that, and that becomes your kind of hitchhiker's guide to my child's brain, it'll help you kind of navigate and ask some better questions about which tests are good for what, right? Because yes, I'm aware of the intelligence scale for kids. I think it's the Whistler. I'm looking it up now because I couldn't remember his name. The Wechsler intelligence scale. But there are many intelligence scales, and those intelligence scales are pretty much just broken down into smaller ingredients, smaller core resources. We used another company that's called Cambridge Brain Sciences, and these you can do online, and it's 12 core functions of mental processing, and that's really helpful too. There are many. That's going to be the challenge. Is this one good or is that one good? Is this one better or is that one better? Well, what are you trying to accomplish? Is a hammer better than a screwdriver? Well, what are you trying to do, right? And so that's again, that's my another attempt to not give you a straight answer.
But I will tell you the one thing, kind of like we said earlier, where you don't want ADHD. Okay, I've got it. I'm stuck with it. That's me. Well, with an intelligence test like the WISC, just know that you've got to really interpret it, and if all you do is you look at the composite score, it gives you some information, but that's not a true picture until you really look at all the different subtests. And most of the time, what happens is parents end up with a score that categorizes their child somewhere. And as a practitioner, if someone comes to me with a WISC, I'm going to be looking at all those different subtests to see, where the child's strengths and weaknesses are, and how they clump together and things like that. So.
Yeah, absolutely. I mean, we do the neurocognitive test. We also do the IVA too, which is like a TOVA, which is just a big fancy way of saying we're measuring attention and impulse control. And it breaks those down into visual and auditory processing. And yes, we really want to know what the individual aspects of that child's score are, because that's what we want to train. And then we train those up, and then the scores go up. In fact, we expect the scores to go up. We believe on our part we failed if we didn't help the scores go up. And so but we need to have that interpretation, and that interpretation is really, really important. So yeah, I agree.
Great. I realize that it's WISC. The IV is for 4 Roman numerals. Okay, so that was great. Great, Maddie. But anyways, I just want to thank everyone for their amazing questions and comments. We love just connecting with our audience, and it's so cool to hear your guys' experiences and where you're coming from. If you are watching on the replay and you have a question, our Facebook group Mom Squad is always a resource there for you. It's a great place to connect with other parents who might be going through the same thing, or, we always try to check in and answer questions there as well. So just a reminder that is there for you guys too.
Perfect. Well, we have really had some great exploration here today. This has been really fun. This is LD Expert Live. I'm your host, Jill Stowell, and we have been speaking with Dr. Giancarlo Licata, founder of Vital Brain Training and Vital Head and Spine. We've been talking about attention, and I'm going to give you some quick takeaways because we explored a lot of things. First of all, poor attention can be a symptom of the learning problem, or it can be the cause of the learning problem. And at Stowell Learning Centers, that's one of the things that we have to sort out in our assessment, because the training is going to look different depending on what the real issue is. Number 2, attention is not an all or nothing issue. There are many different components of attention, and any one person can have some attention strengths and some weak areas. Sleep, low sugar intake, diet, and a calm environment will support your child's attention. And attention and the components of attention can be trained. Dr. Licata, it is always great to have you on the show. Thank you so much for taking the time to be here with us today.
Always a pleasure.
We are going to put up Dr. Licata's contact information, the information for Vital Head and Spine, actually. They have many services, so be sure and check them out online. This is LD Expert Live, your place for answers and solutions for learning disabilities, dyslexia, and auditory processing and attention challenges. We're live every Tuesday at 10 a.m. Pacific. Next Tuesday, we will be talking to Sharon Leisure, a classroom teacher in Colorado, and Brianna Hurst, one of our Stowell Learning Center remote session supervisors, about making distance learning work. Parents, this is your chance to ask all those burning questions that are coming up about your child and remote school. Stowell Learning Centers are open for remote sessions and screenings. We are also seeing students on site with all of the COVID precautions. We work with children and adults doing targeted brain training to improve thinking and learning. If you would like a free consultation for yourself or your child, give us a call or visit our website at stowellcenter.com. Thank you again, Dr. Licata. Thank you so much. This was really great. And thank you for all of you who have been sharing and subscribing and joining us each week. You are the best. We'll see you next week.